Once you are fully vaccinated, 2 weeks after your last dose, you can shed your mask.
You can shed your mask once you're fully vaccinated. Joining us now on this very big day is CDC Director Dr. Rochelle Walensky. Dr. Walensky, it's a real pleasure to have you with us tonight. Thanks for making the time to be here.
My pleasure. Good evening, Rachel.
So I have a lot of feelings about this announcement, if I could just speak in personal terms. When you said today in that briefing, we have all longed for this moment, like my heart leapt into my throat. It's true, and it is such great news after all this time. And at the same time, I am very nervous about what you said today. It is hard for me to imagine myself, waltzing into the Stop and Shop tomorrow morning and not wearing a mask. I just feel like I'm not wired that way anymore, and it still feels risky. So again, forgive me for speaking in personal terms, and I don't mean to be too blunt about this, but how sure are you? Because this feels like a really big change.
We're sure. There's an extraordinary amount of evidence now that demonstrates the vaccines are working in the real world, in cohort studies, in care facilities, in across all states, that these vaccines are working the way they worked in the clinical trials. Importantly, there's also new data, just even in the last 2 weeks, that demonstrates these vaccines are working in against the variants that we have circulating here in the United States, and also data has emerged that has demonstrated that if you are vaccinated, you are not likely to asymptomatically shed the virus and give it to others. So it is this coalescing of all the evidence now that tells us really it is safe to take off your mask. Now, that said, I think your point is really well taken. For the last 15 months, we've been saying wear a mask. And so it's been ingrained in us. You can't leave the house without a mask. I went for a walk for the first time without a mask outside a week ago, and that felt strange, right? So I think we all are going to have to become comfortable with this again. But what we're saying is now is time to make those efforts to start getting comfortable.
You're going to, I know, end up reiterating some of what you just said in order to answer these questions. But I surveyed a lot of people, both on the staff of this show and in my personal life today, in terms of things they feel nervous about still, even after listening to you and listening to the president today. Here's one. If I am vaccinated and the coworker that I sit next to at work is not vaccinated, is it really safe for me to not wear a mask all day at work if I know that I'm in the presence of people who aren't vaccinated? I can't control whether or not they're wearing masks. I can only control whether or not I do. Is it safe to be around somebody indoors all day long who hasn't been vaccinated, who may not be mask compliant?
What I would say is it is safe for you as the vaccinated person. You're 95% protected from disease, and in some studies up to 97% protected from disease. For those breakthrough infections that can, rarely occur, for the most part, they are resulting in asymptomatic or very mild disease. So it's really quite safe for you, the vaccinated person. It's not safe for the unvaccinated person, especially if that person is taking off their mask. And so what we would say is for that unvaccinated person, please do either keep your mask on or, in fact, better yet, go get vaccinated.
In terms of breakthrough infections, people who are vaccinated, who are nevertheless contracting COVID. I know it's a very, very small number of people, but you and the CDC have talked about the fact that there have been thousands of these cases. Importantly, they're less dangerous cases of COVID. They tend to be asymptomatic cases. Very, 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 very small proportions of people who are vaccinated who still get infected end up very sick or having to be hospitalized. They also pose less of a risk to other people in terms of having a high viral load, shedding virus, all of those important things. But have we learned anything with now having, tens of millions of people vaccinated in this country, with hundreds of millions of shots out there? Have we learned enough about the differences between the vaccines? Can we yet say whether there's more or less of a chance of a breakthrough infection with any of our three vaccines? Or should we still think about them all as essentially offering equivalent protection?
So we do know from the clinical trials that the vaccines did what they were supposed to do. They were supposed to prevent severe infection, hospitalizations, and death. And all of them worked equally well in doing so. They were essentially 100% effective in preventing severe infections, hospitalizations, or death. Do we know exactly whether one vaccine might result in more asymptomatic infections than another? That is still under study. But for the most part, when we have seen these studies that have been doing screening of people, testing of people who have been vaccinated, what they're finding is when they're asymptomatically infected, rarely asymptomatically infected, they're not shedding virus to others.
On that point, I guess I have a testing question too. When I think about my own experience over the past 14 months, if I found myself for some reason in a car without a mask on, with other people who didn't have masks on, or in some other sort of enclosed space where we didn't have masks on, over the course of this past year, I am now wired to think of myself as having been exposed and needing to get tested because I've been in an unsafe place. Now that I have been fully vaccinated, I hear you in terms of how safe I am, even in that kind of an environment. But under what circumstances should I still consider getting a test? Should I be worried about having an infection that's asymptomatic? Should I be just looking out for symptoms? Those of us who are vaccinated, when do we test now?
So really, our guidance actually updated on this a bit ago, several weeks ago, and has basically said that you do not need a test if you're fully vaccinated and you've been exposed. However, you do need a test if you're fully vaccinated and you have symptoms. So this is one of those things I think is really important, and that is if you are vaccinated and you have symptoms of COVID-19, please do put your mask back on, go get yourself tested, and keep your mask on until your test comes back negative.
Let me also ask you about the exceptions to the broad rule that you laid, or the broad guidance that you laid out today. It makes sense to me that in congregate living, congregate care facilities, places like homeless shelters, nursing homes, healthcare environments, jails and prisons, that even vaccinated people are advised to still wear masks in those kinds of environments because of the risks associated with those environments specifically. I don't really understand the transit guidance. What is it about being on a bus or in a plane or in a bus depot or an airport that's different than being in a restaurant or a bar or a grocery store? Why do we have that exception for transit?
Yeah, this is a really important question. Thank you for that. So this guidance today was about individuals and what individuals who are vaccinated can do. And we now at CDC have the hard work in the weeks ahead of taking all of our guidance, our child care guidance and our school guidance and our camp guidance and our travel guidance, and updating it in the context of what we can do as individuals. Importantly, for the travel guidance, we have travel guidance, but we also have a travel policy that involves not just CDC, but multiple agencies coming together at a policy. And that policy is another thing that we are going to have to look at in the context of our new guidance.
So if policies around wearing masks on transit are revised, the CDC guidance about masks on transit would also essentially revise to comport with those policies? They're sort of being addressed in tandem?
Yeah, we will collaborate together among different agencies to decide what to do about our current travel policy.
Okay. Last question for you. For parents who have kids under age 12, obviously the Pfizer vaccine now is approved for kids age 12 and up. But if you've got kids under age 12, how do you approach this new guidance within your family? Do kids need to keep wearing masks if they can't be vaccinated, even if their older siblings and their parents have been vaccinated and they don't have to wear masks? It seems like that's going to be an awkward inter-family dynamic for a lot of folks who have kids of different ages or just young kids.
Right. So first of all, let's just celebrate for a brief moment that we have now a vaccine for 12 to 15-year-olds, which I think was really great to see that we can now vaccinate 17 million more people in the United States because of this new authorization and recommendations yesterday. But you bring up an important point about what about children who are between the ages of 0 and 12. And, we have to treat them as unvaccinated. So yes, those children still do have to wear a mask to protect themselves. And the same, sort of mitigation strategies apply. Wear your mask, distance if you can't wear a mask, go to well-ventilated spaces.
Dr. Rochelle Walensky, Director of the CDC, congratulations on, I mean, in some ways, this is an achievement of our public health folks and an achievement of the CDC to get us to the point where we can announce this kind of historic change in guidance today. Thanks for being with us on a big day. Come back anytime. As always, let us know if anybody starts messing with you and the scientists at the CDC, and we'll knock their block off for you. It's good to see you, Doctor. Thank you for being here.
You too. No problem so far. Thank you so much.
All right. Let me know. You know how to reach me. All right. It is an amazing thing. I mean, I will just tell you at a personal level, I'm sorry for speaking of all that in such personal terms with Dr. Walensky, but when I was talking to people today about this new guidance and what to ask her, everybody had very personal feelings about it, and I realized I did too in all these questions. Part of it is that I feel like I'm going to have to rewire myself so that when I see somebody out in the world who's not wearing a mask, I don't instantly think you are a threat or you are selfish or you are a COVID denier and you definitely haven't been vaccinated. I mean, we're going to have to rewire the way that we look at each other because the CDC's guidance, which she just told me, we are sure, is that if you're vaccinated, you don't need to wear a mask except in very specific circumstances. And so that means as we change that as a country, we are going to look at each other differently and have to unwire our preconceptions about what a mask or a lack of a mask means. President Biden spoke to that a little bit today, asking for people to, President Biden actually and Dr. Fauci both spoke to that today, asking for people to essentially be patient, be compassionate, give people respect for whatever they decide on this front, because with this changing guidance, we're going to now have changing norms, and we got to give each other space to have feelings about that as we go through what's going to be a big change that's going to create a lot of visceral reaction in a lot of us just in our day-to-day lives. It's a big day, big change. Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.